Okay. Good afternoon. My name is Brittany McGill, and I am the Chief Nursing Officer for the health system. Thank you guys so much for coming today. We are here to celebrate a very momentous occasion. We have successfully accredited our Obstetrical Emergency Department, making us the first in the state and the nation to achieve this accreditation through the CIHQ, which is the Center for Improvement in Healthcare Quality. Yes. I would like to thank our healers, our physicians, clinical leadership, and our board members, who a couple of them are here with us today, for their unwavering support, all for the purpose of patient care. So our OBED, as we lovingly refer to it, will be another center of excellence. And I want to talk a little bit about what that means. A couple years ago, we went on a journey for our strategic plan that had two prongs to it. The first was bricks and mortar. That was our facilities and our buildings. And that was all around a topic called Inspire Health, which you can see the progress of that outside today. And the second was programmatic, and that was around building centers of excellence. We wanted to take our key service lines and go through the process of doing the work, showing that we could produce excellent patient care outcomes that met evidence-based quality standards. And so that's what we have achieved for our OBED today. And because the OBED is a center of excellence, it joins our perinatal center of excellence, who is accredited through the Joint Commission. And that perinatal center of excellence actually just went through their reaccreditation, but they took it a step further and took the advanced approach. And so we're very proud of that team as well. I'm now going to turn it over to Richie Splitt, who is our president and CEO.
Thank you, Brittany, and thank you all for being here. This truly is a momentous occasion. It's a great day for Norman Regional. It's a great day for our patients and our community, and I'm excited to be here. I'll reiterate some of the things that Brittany mentioned in my remarks, and again, wanted to welcome you here today for this announcement. So it's with great pride and excitement that we announce this momentous achievement in obstetric emergency perinatal care. So first, we proudly declare that Norman Regional Health System has become the first in the nation to achieve our Obstetric Emergency Department program certification. This certificate, yes? And this certification signifies a significant milestone in our Norman Regional's unending commitment to the provision of exceptional care for all of our patients, and in this case, our expectant mothers and their babies. Our OBED, Obstetrical Emergency Department, our OBED program received the gold standard stamp of approval for our steadfast commitment to the highest standards of care in obstetric medicine and emergencies. It provides expectant mothers with the assurance that they will receive immediate attention, timely intervention, and surgical capabilities should the need arise. Secondly, as Brittany mentioned, for our mothers, their infants, and their families, it's with great honor that I announce also that Norman Regional is the first in the state to achieve the advanced certification for our perinatal services. Advanced certification sets a new standard of care in excellence in our state across that healthcare landscape of Oklahoma, ensuring that our patients receive the highest level of comprehensive, evidence-based care throughout their entire journey of motherhood. At Norman Regional, we understand the critical importance of perinatal period involving both pregnancy and the postpartum period. This certification demonstrates our position as a leader in perinatal care for the region and our state. Again, we're proud to announce these two important certifications today. Both demonstrate our commitment to providing leading medical services in Oklahoma with leading technologies inside this beautiful, state-of-the-art, expanding facility. And in this place of healing, our healers strive every day to promote health, wellness, confidence, and trust, and the utmost peace of mind for all of our patients. I should also note that these two accreditations join 4 other centers of excellence at Norman Regional Health System. They include cardiovascular services, orthopedic services, stroke care, and bariatric surgery. Each of these centers of excellence sets a high bar for high quality patient care. And it's all right here in our community in Norman, Oklahoma. As you walked in today, as Brittany mentioned, you saw, no doubt, the construction that's happening all around us. And as you're learning today, while these buildings are expanding, we have not stopped improving the care that we provide to all of our patients. The skillful hands and the caring hearts of our healers at Norman Regional are busy and hard at work each and every day, caring for you, caring for our patients in the best possible way. I'm truly proud of each of our healers. I'm truly proud of their efforts to make these two impressive certifications possible for our health system, for you, and for our community. Thank you again for being here today. And at this time, I'd like to introduce Michelle Schaefer, who is with the Center for Improvement in Healthcare Quality.
Good morning, everyone. Congratulations again to the Norman Regional Healthcare System for achieving this incredible mark of distinction. It is obvious that great effort went into this task, and it's wonderful that you'll be recognized for it. So how does a hospital demonstrate to patients, payers, and your community that the care you render is truly a cut above? CIHQ Center of Excellence designation means that Norman Regional meets evidence-based standards and performance outcomes that reflect high quality and safe patient care. Standards are based, in part, on federal regulations recommended by professional organizations and content experts, as well as performance metrics established by the National Quality Forum. Note that the Center of Excellence was developed as a collaborative effort and between Norman Regional and CIHQ. The CIHQ Center in Emergency Services, OB, recognizes hospitals that demonstrate compliance to standards designed to assure desired outcomes in safety and quality rendered to emergency patients in your highly specialized OBED. To obtain a COE, a hospital must undergo a rigorous on-site survey conducted by CIHQ senior surveyors, individuals specifically trained to accurately determine compliance to COE standards. The survey itself consists of a mixture of document review, including required policies and performance data, and visits to targeted areas of the hospital. In addition, surveyors interview key leaders and review staff training records. Norman Regional Health System has achieved CIHQ Center of Excellence in OBED and Rehabilitation Services. That was last year. Well done. Your hard work and perseverance have paid off. Warmest congratulations on your achievements. Thank you.
Hi. Most people are a little taller than I am. Good afternoon. I'm Dr. Jessica Hinojosa. I'm the medical director for the Obstetric and Gynecology Department. What we're here to celebrate today, and what many of you may be hearing about for the first time, has actually been years in the making. Norman Regional has been making huge strides to improve patient care. Pregnancy and postpartum patients are unique and often require a level of care that is sometimes out of the scope of the traditional emergency department. Early recognition and accurate treatment of obstetrical emergencies has the potential to save not just one life, but two. In fact, in July of 2018, on our very first day of having an OBED, or Obstetrical Emergency Department, we had a life-saving event, and there have been numerous since. Through the guidance set forth by the Center for Improvement in Healthcare Quality, we have demonstrated our ability to provide safe, quality care before, during, and after delivery. We have improved recognition and treatment of severe maternal hypertension and maternal mental health, as well as other conditions. Our work is not finished here, but today we take a moment to recognize these significant achievements. So thank you for being here to celebrate with us today.
Good afternoon. I'm not Rocky Domino. Dr. Domino woke up ill today, so I'm filling in for her. My name is Dr. Shauna Yeager, and my role is Vice President of Clinical Operations with OB Hospitalist Group. So we're super excited to be a part of this certification and to celebrate this with you today. This is an important milestone for the hospital, but especially for OB Hospitalist Group. It was 17 years ago that an OBGYN, Dr. Chris Swain, had a moment where he scratched his head and was asking himself, why are all of these OB physicians working so hard, getting woken up in the middle of the night, taking care of patients over the phone from their bed? Why does a 15-week pregnant patient with a problem come to the emergency room and get seen by a physician and hopefully okay and sent home? Yet if she comes into the hospital 6 weeks later, when she's 21 weeks pregnant, she's seen with her doctor at home, or maybe her doctor's in bed, or maybe in surgery or in the office. And if there's, hopefully everything's okay and she's sent home having not being seen by a physician, or if everything's not okay and there's something emergent, there might not be any OB in the hospital, which could cause a delay in care affecting two patients. So that's where the whole idea for an OB emergency department came from, because we had, the doctor was at a disadvantage trying to manage the patient from home, the nurse is at a disadvantage, and certainly the patient is. So that's where the whole idea for an OB emergency department came from, so that we would have one level of care for all pregnant patients, regardless of what their gestational age. That's what has happened at this program. Since 2018, you've got an OB emergency department solving for that, and even going a step above, seeing postpartum patients. It's well known that we need to do better in the United States on decreasing maternal mortality, and we know that many of the mortalities happen in the postpartum period. So having those patients be seen in the OB emergency department, where they're seen by the doctor who is an OB doctor who is in the best position to take care of that patient and with no delays, is happening here. And that's a great example really for all hospitals to emulate. This certification also means that any gaps in care, any gaps in processes, or in the whole patient flow have been identified and have been rectified. And so we're just really so excited to celebrate this with you, and also to have our doctors be the ones that are manning the OBED and here in-house 24/7.
Hi, I'm Dr. Kate Cook. I'm a pediatric hospitalist, and I'm the current chair of the pediatrics department. When I took on this role, my calendar suddenly filled up with all of these perinatal care meetings. And it was the first taste that I got of all of the work that's going on behind the scenes to make this day possible. So the certification, the advanced certification in perinatal care, involves multiple teams that are in any way involved in the safe delivery of babies. So that could be our OB emergency department, the labor and delivery, mother-baby unit, women's and children's, lactation services, neonatal transition team, and neonatal ICU. So this is a whole family of people working together to create safe outcomes and healthy families. So seeing the work that goes into this process has made me so proud to be part of this health system where people are constantly striving to not just provide good care, not just show up and do their job, but to raise the bar and say, how can we be even better than we are right now? So well done. I know that you are the face of the teams that are working so hard to make this care possible. So I appreciate all of you and your teams for the work that you've done, and for the confidence that you've instilled in our community that their loved ones and their new children will be getting the best care that they could possibly get by coming to Norman Regional. So well done.
Good afternoon. My name is Barbara O'Brien, and I am the director of the Oklahoma Perinatal Quality Improvement Collaborative. So we work with all of the birthing hospitals in Oklahoma. We are providing education, we provide resources, and we facilitate quality improvement initiatives in those hospitals. And I've been in this position now for 21 years. I can tell you since the very beginning that Norman Regional has always been a hospital that says, yes, we want to join in this work. We want to improve. How can we make ourselves better? Now, that's not always the case with all of our hospitals. So we certainly appreciate Norman Regional being willing to step up and join in. And what I think it comes down to is the culture here in Norman Regional, that they have a culture that supports improvement, supports striving for excellence. And this is from the staff nurses, the unit clerks, the surgical techs, the physicians, the leadership of the hospital. They support all of these people to lead these initiatives and take the time to do that work. It is hard to do the work that we ask hospitals to do. We are asking hospitals to change. Change is not always easy, but Norman Regional has always been a leader to step up to the plate to say, yes, we want to do it. And yes, we will lead. We will help other hospitals. I'm sure that they are going to be helping other hospitals that want to achieve the advanced certification for perinatal care or the Center of Excellence for OBED. We collaborate in Oklahoma because our vision is that no matter where, we strive for a culture of safety, excellence, and equity in perinatal care, so that no matter where an infant is born, where a mother has her baby, that mother receive care that is safe, that is of excellent quality, and that is equitable. I know Vince Lombardi once said that perfection is not achievable, but if we strive for perfection, we can catch excellence. So I thank Norman Regional for being a leader in our state, and you all that you always strive to achieve excellence. And I can tell you they get pretty darn close to perfection. So thank you all, and congratulations for all the hard work and these achievements.
And I'd also like to introduce our site director from OB Hospitalist Group, Dr. Kendi Aguilar.
Good afternoon. I'm Kendi Aguilar. I have stepped into the role of site director here at Norman Regional, a program that I had not been familiar with before starting here. I'd never heard of an OBED. And I think just going through the process of working in the OBED, becoming a leader in the OBED, we provide just a level of care, a safety net that I think I've never seen in a hospital before. I have worked in other places, and I think that our role of supporting the physicians, the private OBGYN physicians, supporting the nursing staff, has really been beneficial here. This certification is just a recognition of something that we've kind of strove for the entire time that this program has been open. I think we've provided excellent care, and now we have basically an objective affirmation of that. So I am very honored to be a part of this group. My team, unfortunately, is not all here, but they work very hard. Proud of each and every one of them. And thank you for letting me participate in the care of your patients.
I'm going to wrap us up. I hope you've enjoyed hearing from all of the several people that have such important, valuable roles in all of this. It truly does take a village. We've got several partnerships that are all driving for the same thing, and those are for our patients. So please enjoy some refreshments, and any of us will be glad to answer any questions if you'd like us to hang around.